Botox is the brand name of a neurotoxin made by the bacterium, Clostridium botulinum, a type of bacteria that causes food poisoning. The bacteria C. botulinum is found naturally in soil, but it doesn't make botulinum toxin unless it's growing in a low-oxygen environment. There are 7 different types, called serotypes, of botulinum neurotoxin. 2 of these serotypes are used for cosmetic and medical purposes. Serotype A is mainly used cosmetically to treat wrinkles and fine lines. Serotype B is mainly used to treat muscle spasms. Reconstitution and dilution. Most of botulinum toxin type A products are vacuum-dried powder form that appears as a white cake at the bottom of the bottle. Vacuum-dried powder of botulinum toxin should be reconstituted with normal saline, which does not contain preservatives, 0.9% benzyl alcohol. When the normal saline is injected into a vial, the white cake of botulinum toxin at the bottom instantly dissolves, becoming a colorless, transparent solution. It should be noted that the vacuum can pull the normal saline rapidly into the vial to make a foam. The foam made during reconstitution is believed to denature proteins of botulinum toxin and inactivate botulinum toxin. Thus, prior to injecting normal saline, the vacuum is released first by inserting a needle connected to the syringe filled with 6 to 8 milliliters of air. Do not use the vial if the vacuum does not pull the air into it, since it may have been contaminated during distribution. I prefer dilution with 2.5 milliliters of normal saline and use 1 cubic centimeter syringe for injection. Thus, to use at a concentration of 4U/0.1 ml. Because Botox instantly dissolves, no need for vigorous shaking of the bottle. I use 1 cc syringe for injection, taking only 0.5 cubic centimeters for each syringe. Finally, 5 syringes are used. Each one syringe thus has 20 IU, and each 0.1 milliliters contain 4 units for easy injection. Following normal saline dilution, botulinum toxin should be stored in the refrigerator. According to the guidelines of the manufacturer and the Centers for Disease Control and Prevention, botulinum toxin should not be used more than 4 hours after reconstitution with normal saline due to a decrease of potency.